So I've written extensively about this stuff, and you can go to Amazon, type in my name, Travis Jewett, and find the books that I go through a lot of these things. But low back pain, what actually works? And I was putting together a newsletter for work, and I wanted to turn around and formalize it for a bit of a video for you. So if you've had low back pain, congratulations, you're a person. 80% of people at least will have back pain at some point in their life, and it's the most common reason, one of the most common reasons people will miss work. It's one of the most common reasons somebody will seek a healthcare provider, and it's also one of the most misunderstood issues that people deal with. Because the second that somebody's back hurts, they will open the internet and things will get sideways real fast. So people immediately are going to start looking for the disc that's the problem, the tight muscle that's the problem, their weak core, some sort of misalignment in their back, their pelvis is out. They're just scouring for some magical corrective exercise they can do. Or the other favorite term is that root cause. I'm looking for that root cause that's supposedly causing the whole issue. And I've been doing this for almost 20 years, and the bad news is it's not that simple when you're working with these issues. If you're coming to me and you have back pain, there's 3 questions I'm thinking about. First, is there anything serious happening? That's always number one. Because there are very serious causes of back pain, and they're just not very common, but they're there. So if you have back pain and you come to me and there's loss of bowel or bladder function, there's numbness or tingling in the crotch, saddle region they call it, there's significant and quickly progressing muscular weakness, you're losing weight unexpectedly, you have back pain and a big fever, there was a major traumatic event associated with it, or if this back pain is new but you also have an extensive history of cancer, then these situations are going to need a clear medical evaluation, not debatable. So we're going to send you out to look, just make sure any of those things are happening, that there's nothing serious going on. Then we can ask, well, how do we calm things down now? Because you'd like to be able to get back to doing some things. And people don't need a long biomechanics lecture. They just need some relief so they can get back to functioning. So we just try to work through that. And I am a strength coach. I am a chiropractor. So let's talk about that real quick. Let's talk about the adjustment, as the chiropractors like to call it. Because somebody's always going to ask that question, does a chiropractic adjustment help? And the short answer is it can. There can be some benefit to it, but not usually for the reasons that the chiropractor you've probably seen in the past has told you. There's no evidence at all that a chiropractic adjustment is realigning your spine in any way. We're not popping a vertebrae that was out of place into place. That's just not true, and it's not how I explain things to people. If we do use some sort of manual technique that people would call a chiropractic adjustment, I'm using it in a way to see if it's going to help reduce some of the pain now. Is it going to help you move better right now? Is it going to make it easier for you to bend over right now? Is it going to improve your ability to walk now? Is it going to help us go out to the gym portion of the clinic and do some exercises without discomfort? We're going to be able to do a little bit of lifting without discomfort. Then there's value there. And the value is in the opportunity we've created to do some real work, not in the adjustment. And there's now an opportunity for us to move, to start rebuilding some confidence, and to start clearing the path to you getting back to more normal existence. So the big mistake is that that kind of manual intervention isn't the finish line we're looking for, it's the starting line. And that's where everybody gets confused because they think that that treatment is some sort of recovery, and it isn't. The treatment gives us the opportunity to start stressing the body to adapt and recover. So the research is always pointing us towards that there's not some magical technique, there's not some sort of magical exercise. When people have back pain, the evidence points us towards very boring fundamentals. It's a short list. Stay active in as tolerable ways you can. Get out and walk. Start doing some tolerable strength training. Start to work on your sleep. Start to cut out some things in your life that are stressing you that you can. Get back to doing things you enjoy as quick as possible. And then we can start rebuilding confidence and capacity in your ability to continue those things. What doesn't work is lying in bed, searching your surrounding area for somebody to give you the perfect diagnosis. Another thing that doesn't work is avoiding moving, treating your spine like it's fragile glass. Because every time you start avoiding things out of fear, you're just teaching your nervous system, reinforcing to your nervous system that the movement that you continue to avoid out of fear is dangerous. And this becomes a difficult cycle to break the longer it goes on for. So, over the years, I've seen lots of people with disc bulges, herniations, arthritis in their spine, degenerative disc disease going on, and I've gotten them deadlifting, gotten them back to their sports, I've gotten them back to work, back to their normal life. And it's not because we changed anything about the MRI, it's because we helped them get confidence back and get their capacities back. And what happens when people come in to work with me is they see that I operate a lot like what they would consider physical therapy. And most of that's just because my background is more in coaching than anything. And it's simple because the evidence points all of us that work in musculoskeletal healthcare in a similar direction. Get people moving more, get people stronger, get them more trained, talk them through reducing their fear, get their confidence up, help them build resilience. And in the end, all clinicians that are working in those similar guidelines are going to end up looking very similar at when you work with them. And it doesn't really matter what letters are behind their name because we're all going to kind of guide you the same way. So the goal isn't dependency or needing me forever. We need you capable, resilient, and confident enough to get out there and handle the things in your life that you're avoiding that brought you in the first place. So your back is stronger than you think, and I tell people that a lot. And most episodes of back pain are not signs of any sort of serious damage. It's usually just a temporary pain because your nervous system is a little freaked out about something that's going on. But the overwhelming majority of back pain is manageable, responds well to movement, responds well to exercise, and responds well to gradually returning to your normal activities. So we're not looking to create some perfectly protected spine, some perfect posture, some perfect alignment, some perfect movements. We're just trying to get you back to tolerating your life. We want a back that can bend over, a back that can lift things up, a back that can take you to work, a back that can play, and a back that can recover, because resiliency is your best protection over future incidences of back pain. So remember, your back is not fragile, it is very adaptable, and you need to start treating it that way.